So this is a presentation related to obesity in Canada, and I am Jamie.
I'm Helen.
And our other group members are Kelvin and Ollie, and we're going to just discuss obesity from what we've researched. So Helen, obesity has been in the media lately. Do you think that there is a problem in society today?
Yes, I do think that there's a problem. I think that children are basically inactive, and we need them to get them active again. I think sometimes that maybe the expense of programming comes into play here. So we need to come up with some recommendations of what can help the public and get them out there and get them active again.
Yeah, for sure. I think that's a big issue right now is, there's not enough programs available for these children, and obesity, if it's something that starts in children at a young age, that it's definitely going to carry into their adult life, for sure. Do you think that there are enough programs available for low economic stats regarding obesity?
No. And when I say that, we have a child tax credit of $200, and that barely covers 2 to 3 swimming lessons for a family of maybe 3. That doesn't go a long way.
Yeah, for sure. Like I'm thinking just in regards to different families, I guess idea might be there to enroll their kids into physical activities to get them active, but the fundings or finances are simply just not there. Can you give us a brief overview of the article that we read about?
Yeah, the article was, it happened in the States where a mother was charged with child abuse. The problems that I thought was the youth was 14. Here in Canada, we have our children that can take a babysitting course, for instance, and be responsible for other children at that age. I personally think that there might be some psychological problems here. We're not told if there's medical problems. And being 14, and a single parent, this mother was, she can't watch the child 24/7, and the child needs to take a bit of responsibility as well, as well as the mother.
Yeah, absolutely. So it's the focus, or the focus that we were interested in was the mother didn't necessarily need to be charged with neglect and child abuse. It was more or less looking at different factors. Why did this happen? What could have been done? And different ways that could have helped the family to prevent this from happening.
I think that in some of the recommendations, we need to kind of look at the background of where this family lives. Do they have access to green spaces? Do they have access to schools? Maybe nutrition is another big issue there. What kind of foods are they eating? Maybe the mom and the child could learn to cook healthier meals together. Because meals don't always have to be blah looking. They could be very, very good looking. And presentation of a food is everything, And I always tell my children that you have to at least try it once. You can say you don't like it, but you have to try it once to see if you like it.
For sure.
And there's so many more varieties of foods out there that weren't available. Even 5 years ago, you could see things in the stores. And I think the healthy eating is a big thing.
So it's sounding like the social determinants of health is there's a few that would be a big factor here. Like I'm thinking of, where their geographical location. They might have not had any access to, walking paths or parks to, get physically active, or we need to think about the economic status of the family. was there's just simply not enough funds available to buy those healthy meals. You know, the intent might be there, the mother might have wanted to, you know, get her child eating healthy and active, but just financially she couldn't. And just, you know, genetics is definitely a social determinant. Was it something that, you know, it's something that runs in the family and there was just really no getting around it? So definitely something to consider when we're looking at this case for sure is the social determinants of health. And I guess going forward in this discussion, we can talk about, you know, some recommendations and how we can better prevent this from happening with other families in Canada, whether it be, you know, different programs available, public education, and just making families aware of the seriousness of obesity and what we can do to prevent this from happening. So, you know, to summarize everything, I think it's important that, you know, communities are aware of obesity and it's an issue and it's addressed, because, you know, without the public education, these families are just left on their own to kind of deal with it. So, you know, in this situation in the article, if the mother was, you know, provided public supports after, you know, if they were aware, if, say, for example, if child welfare was involved, perhaps they could have better have educated her on what she was doing rather than, you know, basically just charging her and leaving it at that. Yeah, go ahead.
Another thing too is we don't know for sure, maybe the youth had medical issues, maybe medication he was on, we're not told that. So there's lots of medications out there that's one of the side effects is weight gain.
Yeah.
And so there needed to be a whole lot more education for the mother as well and the youth. And maybe her friends and wherever the young lad hangs out, all those things are very important. And just, I think we all, as citizens, need to be more aware of it. And, you know, watch your own children, grandchildren, because it starts at that very early age to teach them, and as you go through. I know sometimes, I know my granddaughter, for instance, she wanted to play inside one day. I said, it's a beautiful day. No, we're going outside.
Absolutely.
Get outside. We can play indoors when it's raining or, you know, the weather isn't appropriate. But there's lots of things that you can do, but you just have to get your imagination rolling too.
Right. So to address the obesity problem in Canada, it's definitely a matter of looking at, you know, the social determinants of health and getting to the underlying cause of obesity. You know, people are so quick to judge. I think it is important for the promotion of health is to, you know, find that root cause. What can we do to address it? What can we do going forward? And I think that's a good start with addressing the obesity issue in Canada.